Did you know that if you've had lymph nodes removed as part of your cancer treatment, that you are at an increased risk of developing a specific type of infection called cellulitis? Do you know how to reduce your risk? Do you even know what symptoms to watch out for? Hi there, my name is Beth Hoag. I'm a physical therapist who's been working in cancer rehabilitation, including lymphedema and pelvic health, for over 16 years. I'm also the founder of the online cancer rehab space. In this video, we're going to talk about cellulitis after cancer surgery, what it is, how to reduce your risk, what symptoms to watch out for, and what to do if you suspect you have cellulitis. So let's get started. So what is cellulitis? Specifically, it is a bacterial infection within the skin that can progress very rapidly into the lymphatic system and the bloodstream if left untreated. And if this happens, you can get very sick, and this even can become a life-threatening condition. What are the symptoms of cellulitis? One of the most common is an area of redness, and it almost looks like a rash in the area that can start to spread quite rapidly. This area can be warm to the touch. You can also be a lot of pain within the area. Some people develop fevers and chills, almost like they're getting a flu. Swelling in the region is also extremely common, and all of these symptoms can come on very quickly and without warning. So who is at an increased risk of developing cellulitis after cancer treatment? Well, because our lymphatic system is part of our immune system or our infection fighting system, anybody who has had lymph nodes removed as part of their cancer treatment is at risk of developing cellulitis. Specifically, if you've had a full lymph node dissection or even a sentinel node biopsy where they've only removed a few lymph nodes. Now, one important thing to point out here is the entire body is not at an increased risk of developing cellulitis after these types of surgery. And this is where it's important to understand watershed lines with respect to where in our body we're at an increased risk of developing both cellulitis and lymphedema. So that's beyond the scope of this video today, but I have done a video about the lymphatic system, and I'm going to link it in the comments below, so I'd strongly encourage you to go back if you don't understand what I mean by watershed lines. Other things that could increase your risk of developing cellulitis are areas of cracked skin or cuts or scrapes where there's an open area where the bacteria can enter. We also know that having lymphedema increases your risk, repeated episodes of cellulitis, and finally, obesity. All of these factors can increase your risk of developing cellulitis after cancer treatments. Now, I want to pause for a moment and talk about the two-way relationship between cellulitis and lymphedema. I mentioned just a minute ago that having lymphedema can increase your risk of developing cellulitis, but the same is true in reverse. In other words, having cellulitis can increase your risk of developing lymphedema, and this is backed in the literature. So it's really important that you have a good grasp and understanding of cellulitis risk and ways to reduce your risk, as well as lymphedema risk and ways to reduce that risk. Stick around to the end because I've got a great resource to share with you about this if you're interested in learning more. Now, how do you manage your risk of developing cellulitis? We can't control whether or not you had lymph nodes removed as a part of your cancer treatment. That was necessary for your cancer treatment. But the good news is there are some factors we can control. First of all, good skin care. As much as possible, we want to reduce the risk of cuts, scrapes, any open areas in the areas that are at risk of developing cellulitis. This also includes when our skin gets dry and cracks, or whether we get hangnails and open wounds from that. So we want to, as much as possible, keep the skin healthy and hydrated to minimize the likelihood of that happening. Now, the reality is we are all going to get cuts, scrapes, open areas in the body. And so when that does happen, using really common sense first aid, washing, keeping the wound clean, and monitoring carefully for any of those signs that we talked about earlier, which could be a sign of infection. Second, managing your lymphedema risk. Again, we don't have full control over lymphedema risk, but there absolutely are things you can do to manage your lymphedema risk and to identify it early. Again, stick around to the end of this video because I've got some really important information for you to share about that. If you're living with lymphedema after cancer, keeping your lymphedema as well managed as possible is really important. We know that there's a relationship between lymphedema and tissue health. So as healthy as we can keep those tissues as possible will further decrease your risk of developing a cellulitis. Finally, though I know this isn't easy for everybody, aiming to get to and maintaining a healthy body weight through healthy lifestyle choices like a balanced diet and regular exercise. So now that you know ways to reduce your risks and the early signs and symptoms of cellulitis, what should you do if you suspect you might be having a cellulitis episode? First, if you're developing that red rash and you're unsure in its very early stage with no other symptoms, taking a pen and drawing around the area where you have that red mark and monitoring it for spread. If it begins to spread outside that line, that would be a time where you should be going to get some help. Second, if you are developing any of the symptoms that I mentioned earlier in this video, you need to seek medical attention quickly. Remember I said that this can spread quite rapidly and become a very serious infection if left untreated. So seeing a medical professional within that day is really important. If you're fortunate to have a primary health provider and they are unable to see you within the day, it's important that you then head to an urgent care clinic or an ER because this needs to be looked at immediately. Another important note, if you do develop cellulitis and you've been treated successfully with antibiotics, but you're still experiencing swelling after the treatment, very, very important to get yourself some help with a certified lymphedema physiotherapist so we can assess and treat that swelling as early as possible. Well, you've made it to the end of this video, and I promised with you a couple times that I would share a really important resource related to lymphedema and lymphedema risk. As you might know, I've been working in cancer rehab since 2009, including lymphedema. For years, I've been working with clients and hearing them feel confused, stressed, and overwhelmed about the risk of developing lymphedema after cancer. In addition, over the years, there has been an explosion of information on the internet, which can be a great thing, but it also means that there's a lot of misinformation out there, which is further causing stress and anxiety to people. So my solution was to create the Lymphedema Smart Workshop. This is a clear, evidence-informed workshop that gives you information about lymphedema risk reduction after cancer. Specifically, you will learn how the lymphatic system works, what lymphedema is, what is your risk, and how to reduce your risk. You'll also know the early symptoms that come before swelling that you can monitor for so that you can get treatment quickly if you suspect you're developing lymphedema. This will be done through short and easy to understand videos, as well as a very comprehensive handout that you can use for years to come to look back and reference. If you're interested and this sounds relevant to you, I will include the link in the description box below. So I hope you found this video helpful. If you enjoy this content and would like to see more, I'd encourage you to give this a big thumbs up and subscribe to my channel, all of which is completely free. I invite you to leave questions or comments in the box below, and if you have any other questions you'd like me to talk about in future videos, let me know in that description as well. And just a reminder that any links that I talked about in this video will also be down below. At the end of the day, the best gift you can give is to share this video with somebody else who you think could use this information right away. Because at the end of the day, your quality of life matters. It really matters. Until next time, be well.